So the CDC is now recommending that the public do wear some sort of fabric protection to cover their nose and mouth. That can be the nice fabric mask that people are making. It also can just be a scarf to cover the nose and mouth. But we are really encouraging, both here at Nebraska Medicine and CDC, that the surgical masks that we use in the hospital be reserved for our hospital employees. We obviously all know that there's a limited number of those, so the public should be wearing something such as a fabric mask or a scarf. Those can be made at home or purchased in places like Etsy. Masks are protective, but they're not 100%. They can protect you from the respiratory droplets that may contain the virus, and they also can keep somebody who is symptomatic with the virus from expelling that virus to other people. However, they are not 100%. So we still need to be practicing our 6 feet social distancing, washing our hands and not touching our face, all those good measures to keep us safe. So you always want to be washing your hands before donning that mask, so make sure you're washing your hands very well while putting it on and then right after putting it on, as well as with taking it off. It's always a good idea to wash your hands first before taking it off, and then definitely after you've taken off that mask, wash those hands for sure, because that mask may contain respiratory droplets with the virus, so you want to make sure that your hands are washed thoroughly after removing. And I know this is really hard, especially this time of year with the Easter holiday approaching, which is usually a big family holiday. However, we are strongly recommending that the only people that are in your home are the people that live there. Do not invite visitors of any kind, including extended family, into your home. That not only protects you, but protects your loved ones from the virus. We have phones, we have video chats, we have lots of ways to keep in touch with people. So we highly encourage you to keep in touch with your loved ones through means like that instead of being in contact with them. Well, good old soap and water is just as good as hand sanitizing. So wash your hands, wash your hands, wash your hands if you can't find hand sanitizer. As far as masks, I mentioned earlier, if you don't have access to a fabric mask, the CDC is suggesting using some type of scarf or any type of fabric really to cover your nose and mouth is an option and a reasonable alternative. As far as like cleaning supplies, which I know are very hard to find, you can make your own if you have bleach. You just take 5 tablespoons of bleach, add it to a gallon of water, or you can take 4 teaspoons of bleach and add it to a quart of water to use as a cleaning method. Any cleaning product that has 70% alcohol or higher is a reasonable option to clean with, and it does, reports do show that it does seem to kill this virus if it's 70% alcohol or more. Other ways, the CDC does have a link on their website to the Environmental Protection Agency. They have a nice list of all the products that have been approved for killing of coronavirus, so those are all nice options as well. But nothing beats 6 feet social distancing, hand washing, good hand hygiene, not touching your face, all of those things. So of utmost importance, those are the things we really need to be focusing on. If you are a Nebraska Medicine patient and have OneChart, there's a really great Nebraska Medicine app that's free that helps you log into your OneChart account, and you can get an appointment that way. We are offering e-visits, telehealth visits, and those can help us triage to decide whether you do need to come into the clinic or a hospital setting to be evaluated. If you are not a OneChart user or not a Nebraska Medicine patient, you can always call your primary care doctor or call Nebraska Medicine. We have people triaging people to get them to the right place, but we highly are recommending patients not just walking into places with symptoms. We have lots of measures in place, not only at our hospital, but at our clinics to really protect everyone and to keep patients with potential COVID symptoms safe from affecting others, but also getting them the care they need. So we realize that people are still going to be getting sick with other illnesses. People are going to have flares of their chronic medical illnesses such as diabetes, hypertension, and heart failure. So we do realize people still need care for those type of issues. And people are going to get sick with things that aren't COVID related. So we still want to let people know that we are still providing care to patients for those issues. As I mentioned before, call your clinic. We can help direct you. If we do need to bring you in the clinic, I can reassure you we're doing everything possible to keep our patients as safe as possible in our clinic setting, but also in our ER setting in our hospital. So if we do need to bring you to the clinic or do recommend you go to the ER, please know that you can do that safely and get the care you need. And this is really hard. Having little kids myself, I realize how hard this is, that kids just don't really understand why I can't play with my friends. But it really is important for all of us to be adhering to that 6 feet rule, even with our neighborhood friends. And it's really hard for children, I know that, but we really want to keep our kids safe as well as our young adults, and older adults safe. So the best thing we can do is really adhering to those 6-foot rules. I know, for instance, we just did a virtual play date with some of our friends the other day and had the kids on the screen where they were doing Play-Doh together. So there are really creative ways we can keep kids interacting with their friends without having them do that in person. Fortunately, it seems that our children and young adults seem to be faring better or having much milder symptoms for COVID-19. However, we do know that some kids and adults are still getting quite ill even though they are healthy. But the more importantly even is that our kids and our young adults can still infect our more susceptible population. So the main reason for all of us to be social distancing is just really to protect those patients in our communities that are most susceptible to this virus, so that at the end of the day we can all stay safe and healthy.